I started to study radiation therapy because I wanted to know, like many others in Australia and in the world, my family has been affected by cancer. My brother was diagnosed quite young and I was young at the time and I didn't know who was or what happened to help him get through the journey and get him to where he is today. I wanted to break down and raise awareness of what radiation therapy is and actually show people the journey from what a patient has from the start to the finish. The step one process of the radiation therapy is the simulation process. So this is when a patient comes in on day one. They would have just received their diagnosis from the radiation oncologist and they've come on in for their first CT. What we want to do is line them up and put them in a position that is reproducible and that we can do for a day-to-day treatment. The next step in the radiation treatment journey is creating a plan that is individualised to our patients. This plan is using not only the CT that we've just created on our patients, but many other data sets including MRIs, CTs and other information that the oncologist has given us. Coming in for your first day of treatment, so we'll bring them in into something that we call our linear accelerator bunker, which is where our big machine is held. So there is a big head right at the top. It produces the treatment itself and shapes the dose into exactly where we want it to occur. There are arms on the side of the machine that can take images like a little X-ray or a mini CT scan to make sure that we get the patient in exactly the right position. These scans we're going to match to our original CT that the patients took with us and to make sure you're in the same position. We're going to be monitoring the patient via a closed caption circuit and that we can be speaking to them as well through some microphones that are kept in the room. From there, the treatment will start. The machine may do some buzzing noises, some clunking noises, and it'll spin around the patient. The treatment itself will only take a couple of minutes, and from there, the patient is completely safe to go about their day. So each treatment will only take a couple of minutes. You may be in from anywhere from one treatment to a couple of weeks worth of treatments, but we're going to be there every step of the way to guide you along and to meet you with a smile.